Morning, everybody. We're having technical difficulties. We're just trying to get PowerPoint loaded, but yeah, so today we have Lindsay here. She's going to just go over a method of like how she goes through the problems and explains them. We'll talk about FABC and then we'll do some hip practice. We might start off with that. Yeah.
We'll start off with any specific questions, like if you've been kind of looking at things and you're confused, we can do the what have we done? The trunk, we can do the trunk and the hip. Any questions y'all have about what we've gone over so far in the class for this next exam. We'll just start with that while they figure out the PowerPoint real quick. So any questions specifically so far? No. Awesome, cool. Then we'll just go ahead and get started with some practice.
Let me just do this real quick. I don't really need the PowerPoint. It's like 6 slides, and it's not pulling up. All that hard work.
Oh, look, I have a great idea.
Oh, just put it in front of the, yeah.
Oh. You can't read it, but no.
Yes, they can.
No, that's terrible. That's okay. That's in.
You can absolutely see that.
Okay. Well, that's just, we know this already. We know that, what does this say? That works? Okay. Oh yeah. I forgot to delete that. So, we know, I don't know if you guys, have y'all done the FABC before? Or is that just like my routine that I did last year?
I think we've gone over it before, so
Okay.
they know of it.
So I use this so much. It's better on the
Yeah, you
Thing.
can see it.
So I always did whenever, like even in 310 when we started doing contractions and stuff, I used FABC. And the way you do it, like on the test, I just wanted to bring it back up because on the test, he gave us the motions and he was like, okay, what happens during flexion? Like what contraction occurred when he did flexion? So I already know that this B would be my flexion. Because 4F is the external force, what's trying, like what is gravity trying to do to you? And then A is the agonist, which is in 310, we'll just do like flexors or whatever. But 415, we know the agonist because we can figure it out through FABC. All you have to do is just figure out the muscles. So you look at your circle. So you find your agonist and you're like, oh, it's flexors. Oh, I know it, that it's the S, yeah. So I just really want to bring it back up because he's giving us the motions on the test. And all we have to do is figure out what is gravity trying to do, what is external force trying to do to you? And you plug in the force, you figure out your agonist, you have the motion, then it just gives you your contraction because if the flexors and flexion happen, then you know it's concentric. And flexors and extensors, if they're opposite, you know that it's eccentric. And if there's no motion, then you know it's isometric. Yeah, so I just put a little bit of words in there that you can't read, but it's just basically what I said. But have y'all ever used this method before? Like for a test or anything? Yes? Okay, a few of you guys. I like to use it. Like Dr. Campbell does this in his head. Like he's like, okay, what's it trying to do to you? And then he's like, okay, well then you need these. What you got? Yeah, he's gonna, like, we're gonna have our sheets and stuff, the scratch paper, and we're just gonna be able to draw the circles.
You
I think
do
he
have
even,
to have them memorized. You can't draw
Right.
them from the picture. You have to like know,
right,
but you absolutely, you have your full sheet of paper. You can have more than one sheet of paper. So you draw your circle and then you can have a separate sheet of paper to do whatever method you use to find out.
Lindsay, let me say, just as a reminder. So what I love about Lindsay's method here is you emphasize what the external force is trying to do. So we've done ABC, 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 ABC. And what I needed to realize, which you guys helped me to see, is that, hey, not everybody can just go straight to the agonist. So that step, that F, hey, let's ask ourselves, let's slow down and say, what is the external force trying to do in this exercise so that we can see what my agonist needs to do against it. So I love that extra F step there that I'm going to start incorporating because it helps us to slow down to say, what is this thing trying to do to me? And therefore, maybe I could better see the muscles that I need to go against it.
yeah, I know a lot of people are like sometimes, this is like a really zoomed in version. But like I know sometimes whenever the question's asking you what kind of contraction is it, and it's someone, doing bicep curls, like this is start, this is finish, that's concentric. You can just, you've learned that already. But if it's really confusing, it's really hard, you're not really understanding, it's some kind of transverse kind of plane, this helps you like down to a T, this is how you get the right answer. You're second guessing yourself, FABC. I just really like to use it in class, especially when I'm second guessing myself. Oh, and then I had a stretching PowerPoint too. I didn't even add pictures. Anyways, I had a stretching one too. So I came up with this like in class one day this semester, and I put a, I don't know if you haven't approved this yet, but I did add this in. So it says who and it says what. So if he is asking me what muscles do I, or like what muscles am I stretching, that's the who's. Like that's the muscles of the who's. Or if he's giving you a position and he's like, well, that's more than muscles am I stretching. What was the other one? I'm still working on it, guys. What does the question say in the PowerPoint? Okay. Did the information give us the muscle? So if he tells us, how do I stretch this muscle? We have the who. So we know that we need to find the what. So if he's telling us, how do I stretch the erector spinae? Then we know that we need a motion, which is the what. And then that way you'll know that you need the erector spinae extensors, so you'll need to flex. Because the muscle they are extensors and you need flexion to stretch them. I don't know. I'm still working on it. I was supposed to be more planned than that, but I kind of liked it just to know that it's basically telling me, you need the opposite, of course. So if it's giving you whatever information the question is giving you, it's giving you the muscle, or if it's giving you the position, you need the opposite. But I like to write things down. I like to write it out because it helps slow my brain down. Yeah, and I didn't even do any practice pictures, but we'll do that after. And yeah, that's just saying that if A in FABC, if A doesn't match B, then it's eccentric. And if A matches B, then it's concentric. And if there's no B, then it's isometric. And then also if there's no F, if there's no external force, then it's gonna be concentric. I wanted to add that. But yeah, guys. if you want, to learn more about FABC, I am totally happy to explain to you like how I do it and how I use it for the test. But I can do that after we go through some practice. If you're
And
interested.
Lindsay, I just want to be clear, you do this for every question, right? Like every question
Pretty
you
much,
check.
yeah.
Yeah, and I mean that's good because you have that process really
Mhm.
helps to fill in the blanks and lead you to the right answers.
Exactly. And there's 33 questions on the test, and you have 50 minutes. So I find that I always have time. Now I know it seems like it takes a long time. Really, really simple though, because sometimes you just ask what the muscles are. So all you need is F and A. You don't need the B and C. You just find what the external force is trying to do to you, and you need this agonist, and you look at your circle. I need left lateral pullers. And there's your muscles. The agonist tells you the muscles. You just need to look at your circle and see. But yeah, that's what I got.
Thank you, Lindsay.
And yeah, I can always talk to you guys another time or after if we're finished with practice early. And show you like some examples on how I use that ABC.
I think we'll just go into some practice things. So honestly, I feel like one of the best ways to practice is to go back at Dr. Campbell's videos and look at the examples that he gives. And like, I grabbed these from pre-10. So like, it's kind of like he's doing similar exercises, like the same ones, but now we're just adding, of course, the additional step of using the circles to identify the muscles. So these ones are hip examples. I know we've talked a lot about the hip muscle so far, but we just wanted to give y'all a little bit more practice, applying it. So we'll start with this one, and I'll just give y'all a few minutes to go through it. But we're gonna start at the left and then observe the motion that happens from left to right at the hips. So, I'm a big one. So, we don't need to be kind of. Okay, we are at. Wait, just have to get the circle. Oh, does everybody have their circles pulled up? I feel like there's enough of y'all. Okay. Alright. Okay. So first, are y'all ready? Okay. Okay. So is the motion at the hips the same motion for the right and left hip? Or yeah, it's different motion. So talking about the left hip, what is happening from left to right? The left hip. Yes. Yes. There is left hip adduction. And then for the right hip, what is happening? Yes. Does everyone kind of see why anyone confused about that? So. Oh yeah, so now we're gonna. Sorry, I'm moving past 310. I'm thinking about 310 right now. Okay, so let's talk about the left hip again. So we know that the motion. Oh.
Adduction? Yeah, left hip is adduction.
Yeah, so there's no external force that's like making him adduct his hip, like he's doing the contraction himself. So we know that it's gonna be what kind of contraction? Concentric. So then we know the motion is adduction, so the agonist is gonna be the same as the motion happening, so we're gonna need adductors. Then you can go back to your table, and what are the adductors of the left hip? We can see that it's the gracilis, the adductor magnus, adductor longus, and adductor brevis. Sorry, that was not how I wanted to answer this question. I was thinking about 310, but is everyone kind of okay about how they got their answer?
Everyone sees how to use the circle to find who's doing the work. Yes.
How would like, what is the force trying to use the left?
Okay, how would you explain your FAB?
Yeah.
Yeah.
So in the NABC thing that I just explained, F would be external force, and in this case there is none because gravity's not trying to do anything really. So since there is no external force, then that makes the contraction concentric. Or if you want to say, okay, well, I know it's concentric contraction, then there's kind of really no force involved, or I don't like that actually. So, yeah, but like, of course, if he was, I don't know, laying on his side and the foot was literally gravity's trying to pull his foot down, of course, that's a force. But in this case, the transverse plane is not, gravity's not affecting the transverse plane.
So, because there's no force, like, the motion that he did was left hip adduction, so that you need the left adductors.
Yes.
Yes, so
Because you want them to match. So if there's no force, which is F, then you know it's a concentric contraction. And so that means you also know that A and B, the agonist and the body joint motion, have to be the same. Exactly. And then so we'll do abduction too. Abductors.
yes, so we'll do the abductor or the right hip. No, it's okay. Yeah, we already had that it was abduction, the motion was abduction. So again, we don't see an external force happening here. So then that's when we look at the FAB, if you look at the C part. So we know that the contraction is concentric. So then we know that, like Lindsay said, the agonist and the body joint motion have to be the same. So if we're observing right hip abduction, then we need right hip abductors to work concentrically to do that motion.
And that is the piriformis and the gluteus medius and minimus. But that's not the anterior fibers. That's the whole gluteus medius and minimus. Medius and minimus, yeah. I always want to make sure that I remember about the anterior fibers for the hip internal rotation, but not in this case. It's the whole fibers.
Hey, guys.
Yeah.
A couple quick points. I had a Zoom question. Where can I find the photos? You guys, and I want to make sure I had that right. Y'all emailed the class these, right?
No, so this is a different document, though. There's a document for 310, and we're still working on the one for 415.
Gotcha.
These-
So yeah, but I'll just tell them that they're coming. Like y'all we'll send this to them so that way they could complement the Zoom lecture.
Yes, we will
Awesome.
be sending the.
Okay, let's move on to another one. Okay, so this one we'll have another hip conversation. And we'll go through the answers like FABC. For this one. So yeah.
He's doing this.
Yeah, he's hyping
Sounds
up the
to see.
hip.
So it's hard to see, but
So he's
like Dr. Campbell said, sometimes the clues are in the clothing.
Yeah.
So kind of
you can see how his shirt is slanted. So that kind of gives you a hint as to which hip is moving.
Yes, so it has to.
I'm focusing on like the right hip. Like we're just doing hips, yeah.
Yeah, we'll do the both hips of right and.
Hey guys, while everybody's thinking about it, I'm gonna add something real quick to complement what y'all were talking about when there's no external forces. So remember, muscles can only pull. So if you had like a cup on a table and there's nothing trying to make the cup move side to side, you have to take a rope or a string and make it come to you. You have to shorten to bring something to you if there's nothing trying to move it away from you. So just remember, if there's no external forces, just like the lady said, like you have to use concentric contraction to initiate movement because muscles can't push.
Alright, so is there an external force trying to cause any kind of motion here? At the right hip, we'll look at the right hip. Is there any external force? No. So if there's no external force, let's observe what
There
kind of.
is. Don't you think? Like if I was doing this, gravity would totally try to be putting my hip back down.
Yes, gravity is, yes.
Now, if it was a transverse thing, yeah, but since it's a lateral thing, yes.
Sorry, no, yeah, I'm doing you for this.
It's all about the right.
So,
So,
right, so
yeah, just-
technically, yes, if we were looking at like the hips as a whole. And we were to ask, okay, if he lets all of his muscles go, like gravity is going to try to do something to both of his hips.
A big part of this one is identifying which hip is moving. So you can see that his left hip is coming up.
Yeah.
But the right hip is having the motion. This hip is just kind of tagging along because the pelvis moves as one.
They both have.
Well, that's flexible.
Well, no.
Left hip is.
It's also the left hip here is like if you're pushing this up, like your leg is also going into like there's adduction there. If you.
I feel like that's not very obvious though.
But that's
Yeah, it is.
No, like it's not like, you wouldn't ask a question about the left hip. Could you see that?
Dr. Campbell, we're gonna have you,
Yeah,
Kind.
let me help out. So what we need in this is we need two forces to help spin the pelvis, two primary forces. The right hip abductors are going to create abduction by literally taking the right hip, the right socket, and yanking it down. You feel that? And then the left lateral trunk benders are going to hike the left side up. So there's your force couple. You have your left lateral trunk benders working with your right hip abductors to do this. And even though there is going to be some motion on the leg that's coming up, that's pretty much just to keep your center of mass over your base of support. Because if your leg goes too much there, you're going to fall over. So your left hip is going to kind of adduct to try to keep your mass close to the foot that's on the ground so that you don't fall over to the other side. So the primary muscles that are going to be creating that right lateral pelvic girdle rotation. In fact, if you could do it, if you if you stand on one leg, you're going to start to feel your abductors get tired because you're using those abductors to hike that right side down and your left lateral trunk benders to hike the left side up.
Okay. So follow-up question, would you ever ask a question about what's happening at the right leg? Like at
At the right hip, absolutely, not the left, because the left is more just to try to keep. Remember, we talked about how it's easier if you keep things rigid. So that left hip is going to adduct, but it's not to create pelvic girdle rotation because it's off the ground. So 100%, I could ask about the right hip, which would be right hip abductors, gluteus medius, gluteus minimus, piriformis, tensor fascia lata, and the left lateral trunk benders are pulling the left side up, and we know what those muscles are: left rectus, left external, left internal, left erector. So it's to see that force couple happening with the right hip abductors and the left lateral trunk benders making the pelvis do that.
Okay, awesome. Y'all, everybody heard that and understood what he was getting at? So he also brought up a really good point. We have to identify that there was movement at the trunk too. Everybody sees that. So in order to keep you from falling over, you have to have your left muscles, trunk muscles helping you.
That's correct.
Upright. So yeah, so did that answer your question? Okay, awesome.
Yeah, so this question is definitely more of a right hip conversation, like you were saying. I think what I was getting at with the left hip, I just didn't want y'all to think that like there was nothing, like there was no motion at your hip of like yes there was, but it wasn't like a contraction of those adductor muscles causing you to do that. It was because of the left lateral bending.
Yeah.
That your left hip adducted a little bit. But again, like he was saying, he's not gonna ask you about the left hip because it's more the left lateral trunk causing that motion to happen. The force couple that he's talking about. And yeah.
So this is a good picture to identify who's working at your hip and who's working at your trunk. So this picture is probably fair game, I'm assuming, for hip and trunk. Yeah, he's nodding, so.
Cool. And everyone sees how the right hip is adducted. Yeah, correct. We were going to.
Yeah, so the abductor, the right hip abductors would be piriformis and gluteus maximus, medius, and minimus, I mean. And then the left lateral trunk benders would be the left rectus abdominis, left external oblique, left internal oblique, and left erector spinae.
Yeah.
Would it not also be the TFL or?
Yeah, you're right.
I was making sure.
Yeah, I missed it.
I think for the hip, and
There's so much going on in that
there's a
circle.
lot. So for the hip was probably the most difficult for me as far as like using the circle. I didn't use anything else, but there's a lot going on in the circle. So I think being able to do the practice with the circle and being able to answer every possible combination of things. We will be sending out a bunch of problems and we'll be holding reviews before the exam and all of those things. Just practice a lot with using the circle to identify what's going on because there are so many muscles that go into moving the hips.
Yeah, because just remember, it's just answering that final question from 310. Who are the abductors? and however whatever works for you to remember who are those abduction pullers. It fit it to your learning style.
I feel like practice will help too, because like whenever I see, oh, there was abduction, I mean, I need abductors, then I would know, like, I would write them all down. And after practicing so many times, I don't even have to look at the circle anymore. I know that abductors are these muscles. You know what I mean?
Yes, and then whenever we send out the sheet for y'all with the answers, we'll like do a thorough explanation of why we got those answers. Cause I know our explanations were a little hard and all over the place, but yes. Yes, emphasize the circles for sure. Yes. Yeah, this is the same, just on the other side. Okay. Do this one. This one's gonna be hips. So that's what. Yeah, that'll be covered because of the Trump mistakes. The question you did in the class, he was talking about abduction. Horizontal. Yeah, but there's no hidden emotions. I mean, it's abduction controls. But they're like, they're staying.
They're moving as one in order to move both as one.
And that's what we did in class the other day. I know that's, okay, let's do this one. Oh gosh.
Yeah, oh gosh, there we go.
Let's see the good one. Yeah, this one is really tricky.
I'm gonna have to get down to
We'll have the left hip hop conversation and then we'll do a right hip conversation.
But we're not worried about horizontal stuff, just,
Well, that is.
so it's part of the abduction.
Okay, well, we
We
can,
can abduction of hips, and there's horizontal abduction and abduction of hips.
And so
There's also internal and external.
let's just do this one as a class. So we're here. And we're turning here. Let's talk about my left hip real quick.
Right,
I'm
I'm
gonna
gonna do your other leg.
Yeah, okay, yeah. Okay, we're here, we're going here. So let's talk about my right hip. My right hip is on the floor. It is stuck in the same position. Moving this way. If I were to take this leg out, this is the motion that would be happening, right?
Right.
Everybody sees that? So what's happening?
Internally.
Everyone, internal rotation of the right hip. Everybody sees that? Okay, cool. Now we'll bring this one back. I'm coming this way. So if I wanted to bring my leg back to my trunk without moving my trunk, what had to happen?
Horizontal abduction.
Horizontal abduction. So there's two different motions happening at either hip. So we have internal rotation happening at my right hip. We have horizontal adduction happening at my left hip. Adduction, adduction.
I think it's abduction.
AB going away, AD coming back.
Yes, yeah, sorry.
All
So
good?
is normal abductors the same muscles as abductors? Or they're different?
For our class, because primarily they're most of them are the same. So we are going to, for the hip, if we have, I think we answered this question on the previous class, but I want to answer it again. Like, because if you're in a sitting machine and we're doing like some hip abduction stuff, to keep it simple, we're going to say that abductors are same as the horizontal ab and adductors. When we get into the shoulder, there's going to be some emphasis on some things just because the shoulder has some little bit more movement than the hips. But we're going to keep those adductor muscles And that's what I love about the adductors, right? Because we have adductor in the name of a lot of them. Like love my heart for the adductor muscles, and then that silly gracilis. But yeah, we're gonna keep them the same for the horizontal as the regular AB because it's just easier right now.
Awesome. Okay. So then we'll have the conversation. Who are my internal rotators, hip rotators? Everybody knows how to use their circle to find the internal rotators, because this is kind of the one that's like, there's a lot of arrows going on and making sure you're able to identify those is a little tricky. So my internal rotators are the ones going this way. So we have TFL, gluteus medius, and maximus. Minimus. Yeah. And that's it. So 3 muscles. Gluteus minimus, medius, and the TFL. Everybody sees that? Cool. Then we'll go to our abductors, which are working at our left hip. Who is that?
Piriformis. So, gluteus median.
Those two.
Yeah, and the TFL.
Yeah. So there's 4 muscles. Four. The piriformis. Yep.
Do we have any like gym exercises? Like, yeah.
Like with
Any-
a force.
Yeah, what was the next one first? Or like in like regulation and stretches and stuff. If it was stuff. Let me see. Percent? Yeah, we do like it first.
Yeah.
Or like audio. Would,
Yeah, like any of those. Either machine or the body.
For this one, we'll do left to right, identify agonist, motion, contraction.
So where's it going? Like where does it start? Like where do the weights? Just wait to look at the pads. Okay.
Yeah, for this one you would look at the pads. He might make it a little more obvious than this pictures.
But like you can see if it was the opposite, like if she had the pads on the outside, things, you know, that it's like bringing.
And we're doing left to right.
You still going from right to left,
We'll do left. to right.
left to right.
So this is a good one to where I can show you the FABC method to where, so that I can show you how I got my contraction. So since we're gonna start with the external force. What is the external force trying to do to you? There's no weights in this picture, so we looked at the pads. So the pads are here, and you're pushing against them. So that means that the machine is trying to push the opposite way. So the machine is trying to horizontally abduct or just abduct your hips. So I'll write abduct. The external force is trying to abduct me. And so that means I need adductors, ADD. And so I got that. And then now I gotta figure out the motion. What motion is happening from left to right, which is abduction, ABD. So I'll write abduction. And now we have 3 parts of the formula. Now we just need to figure out the last one. So I can see that A and B do not match. So it is an eccentric contraction. So I got my contraction, but the question's asking for contraction in muscles. Well, all I know is adductors. So I need to look at my circle and see that my adductors are the gracilis, the adductor longus, magnus, and brevis. So that's my answer. Everybody got that one?
Lindsay, I want to add, I love how you simplify it. Like if they match, like almost like lessening the confusion of, abductors, adduction, and just if those two things match in similar sounding nature, it's concentric. And if they don't match, then so it could literally be that simple. So I really like how you did that. Also, don't forget that pesky pectineus. And
Oh.
then and then if you could ask Grace, or if you can rotate the camera to show them your process on the screen, or just take it there to show them. But I love that. Keep it simple. If those things match, concentric, because concentric is bringing things back around. That's the essence of concentric, right? A concentric circle. So when they match, it's literally completing the circle. Eccentric means weird. It should come back around, but instead it goes the other way. It eccentric doesn't match. So I really like that kind of simplistic. Hey, if they match, bang. If they don't match,
Awesome. Yeah, thank you, Dr. Campbell. But yeah, if anybody has any questions with that one, but I think this is going pretty good. Right?
Okay, so we'll do from top to bottom, identify all FABC and muscles. Anywhere. Here. It has to be. So I see it yeah. So then it will come. It's coming back. Yes, so which way is the base? That's the one question I know. Only is last. I don't know, was asking me. And I was just, she's asking me. I was like, just wait, but I felt like. But then I was like, yeah. I was thinking my hips would drop, but like. What if my hips would drop? Anyway, but like. Should I do? Well, the girls would tell us, like, since we got just 5 minutes, just we're talking this. That was the answer. Do that. No. Well, I can do each hamstring thing. That's true.
Good. So, did y'all want to see the FABC way or just say the muscles?
Let's see the thing.
Yeah.
Okay.
And we can show.
Okay.
So what's the force trying to do from top to bottom? Touch your hips, good. So who do we need? Sorry.
Alright.
Sensors.
And then now we just gotta observe the motion from top to bottom.
It kind of depends. I always say who. After identifying who is working, I always go straight to my circle and say, okay, well, who is that? Instead of doing it at the end. You can do it obviously whenever, but.
Yeah, it depends on the question. Is it asking for the muscles strictly? Then you can just
Right,
do
and you
FA.
can just do epic.
Yeah.
So what motion are we observing? Extension. So we have our extensors doing extension through. Concentric, good. So now we get to answer who are our extensors. Glute max.
Then you have member notices, sending to the notices.
Yep.
Last those. All of it.
Yep. Cool. So if he were to ask, is the bicep femoris doing extension here? Is the bicep femoris is 2 heads, is the bicep femoris doing extension?
No.
Just.
No, because it's just a long head.
Okay.
Trick question. Cool.
No, you really.
It's not, that's the one I got on it. Oh, yeah, exam, so that's fine. Okay, good, I think,
Does that method help you guys?
yeah,
Yes.
who used it and liked it? Beautiful, awesome, perfect. Yeah, it helps a lot, that's how I did every single exam for 415.
Yeah.
Was through the ABC. And I use the F too. So, awesome, that's all we have. That's all we have. If y'all have questions, y'all can.
Guys,
ask.
I want to make one point before y'all cut out or answer questions at the end. First of all, y'all did an incredible job. Very proud of everybody. But just remember, just because I own a hammer doesn't make me a carpenter. And just because I own a pot and a pan doesn't make me a chef. And I want you to think of this, just because somebody memorizes a bunch of muscles on a picture doesn't make them a therapist. It's the tools, it's what we do with it. And that's what we're trying to learn by all these practices is understanding how specific muscles create motions through contractions. That's what's going to make you an artist in terms of an allied health professional, a functioning allied. That's taking the hammer and the nail and learning how to use it. So that's why these practices are so important, because again, anybody could just memorize some muscles, but do you know how to use the tools to be able to create your art.
Amen. Thank you guys.
Thank you, Dr. Campbell. Okay, yeah, y'all are good to go. If y'all have questions, ask us. We will be sending out a document with example problems and answers soon-ish, probably before next week. We'll do it before next week. But y'all are good to go. Bye, guys.